changes, the neuroprocessing occurs throughout the lifetime. All right. And there is no specific area where only that area of plasticity is going to happen. No. Different structures in all the areas, they have capacity to modify itself throughout the brain. All right. And how it works? It works on the theory that old connections are being removed and new connections are sprouting out. So when I say sprouting, in neurological terms, it is known as synaptic pruning. The process is known as synaptic pruning. Means the new synapse, the new sproutings, the new neurons are growing and they try again to mingle and connect. All right. Neurons that are highly routed are preserved, strengthened, and denser. The new skills require large collection of neurons to activate simultaneously. So whenever I am doing some task for the first time, at that time, many neurons at a time will get activated. The firing up happening in the brain is in a large proportion. So more the neurons are activated, the better we learn. All right. So now I am talking. So my brain is now in the very conscious position. I know I have to deliver the session. So now my neurons are very activated. And more activated, more focus, and more precision of the task we are going to achieve. So these are a bit few of the practical aspects. I just kept a photograph for you all to understand. All right. So as I said, whenever the neuroplasticity process is happening, there occurs the angiogenesis. So whenever the neurons are newly grown, when they are trying to mold themselves, there is something known as angiogenesis. All right. So angiogenesis means when I say angio, it's related to the vascular, the blood supply. All right. So there is angiogenesis happening in the brain. All right. And the axonal sprouting. So when the neurons are damaged, the axon is going to elongate and the axon is going to grow and it is going to form the whole new neuron. And once one neuron is formed, it is going to create a new synapse with the adjacent neuron. So that is known as formation of new synapse. It is known as synaptogenesis. So these are the different steps where the neuron is changing the structure and the transmission capacity is improved. And ultimately, it achieves the neurogenesis. So, generation of the whole new neuron. All right. And of course, when the recovery is going on in the patient, the inflammation will go slowly subside and parallel the vascularization, axonal sprouting, synaptogenesis, neurogenesis, and even the increase in number of the supporting cells of neurons. This is also very important. Neurons are not only working, along with that, even the oligodendrocytes, which is known as oligodendrogenesis, even the increase in level of supporting cells of neurons is also growing. Okay, so I hope you can imagine how the brain molds itself, how the neurons and the supporting cells are supporting each other and they are trying to create a new network. Of course, this is a very slow and a microscopic process, but yes, the evidence has proved that these things are happening. All right, so having understood this, now I will take you to our physiotherapy aspect. All right, so till now, I have tried to explain you what is neuroplasticity, what is the concept of neuroplasticity, and what are the neuronal changes, the microscopic changes actually happening in the brain and the neurons when the recovery is going. So now, just try to imagine a scenario that neuroplasticity is existing. The magic is there. But as a physiotherapist, what we are doing, we are the movement scientists. We are the healthcare professionals. We proudly say that we get back the recovery. But how? We have seen stroke patients walking back. We have seen the brain injury patients getting back to their normal life. Of course, it takes time, but we proudly say that we physiotherapists regain the function status of the patient. But the magic working behind is the neuroplasticity. So when we do movements, the brain also is getting adapted. The movements will fire up the brain. All right. So I will now connect you this concept of neuroplasticity, all the facts and theory I showed you, to the patient's recovery extent. So now, talking about the recovery, when we give the training to the patient, when we give them movements, so we always tell that a specific intensity is to be maintained. We always give a few, we give to a proportion. There is an intensity of exercise is one of the important principles. So why we always stress that the intensity of the exercise, it should be high intensity, all right, it should be low intensity. So intensity matters. So it is said by research that higher the intensity of exercise, the more is the plastic change is happening in the brain. Similarly, one of the principle is repetition of exercise. So you must have seen when we treat the patient, we make the patient do the repetition. We make them do n number of counts depending on the capacity of the patient, depending on the medical condition of the patient. But we make the patient repeat the activity. So what is the logic? When you do the repetition, every time you repeat a movement, every time the brain, that motor area in the brain is firing up. So every time you move, every time the brain part is getting activated. So it constantly fires up, fires up, fires up. So that's why repetition in physiotherapy is very important, especially when you are dealing with the brain injury patients, stroke patients, where the brain neurons are hampered. All right. And remember, we also apply the principle of specificity. We give exercises to the patient which are task specific. So what is the logic? When you give a specific task, a specific pattern of movement to achieve by the patient, the main logic behind is when you give a pattern or a specific activity to the patient, that is going to fire up a specific pattern of movement in the brain. That's why task specificity is very important. All right. So that's why I mentioned here, training the specific movement or task is more effective than generalized exercise. All right. So that's why in neuro rehabilitation, we give task specific training. We give task oriented training because the whole day the patient is going to do the various tasks like picking up the phone, picking up the glass, all right, cleaning the table, brushing the teeth. So the same task we are giving in the form of exercises so that the brain adapts accordingly. All right. Next principle is meaningfulness of the task. So you should give exercises which are relevant to the patient's lifestyle or the patient's occupation or maybe the patient's daily routine. All right. And even the timing of the exercises, it matters a lot. When I say timing, it's about starting the rehabilitation as early as possible. So in physiotherapy, we always tell early intervention is better. As soon as the patient is getting discharged or the patient is medically stable in the hospital itself, our exercises are started. Always the neurophysician will tell us, you make the patient walk, you at least start with the passive movements, or you at least start with active assisted, but start the movement. All right. So early intervention. As early as possible, we start the movement, the brain is going to get activated. All right. And of course, once the patient is recovering, we also have to progress and make the challenges. You have to make the task little bit difficult so that the brain gets adapted to even the difficult task. You have to always progress. It's not necessary only sit to stand to be done. We have to also progress to stair climbing. We also have to progress to treadmill walking. We also make them do obstacle walking. So we have to progress and make the movements challenging. ultimately you are trying to push the brain with difficult tasks, with difficult movements. And in the background, the brain is rewiring and the neuroplasticity is happening. So don't you think we physios are doing a great task? Yes. All right. So having said that, when we do the movement rehabilitation, the patient undergoes repetitive movements, and as I said, the motor cortex is getting activated. So imagine a patient after stroke, he's just lying down in the bed and doing nothing. And imagine a patient who is doing exercise after stroke. So whenever the patient is doing exercise after stroke, we are trying to activate the brain, to be specific, the motor cortex. So when you do a movement, no matter initially the neurons don't get fire up so easily, but you keep on trying, you keep on doing the movement, may it be assisted also. One day the spark up will grow. It is going to potentially grow slowly. One neuron will activate, another neuron will activate. New synapse will be formed. Then again, few neurons more will be activated, more networking will be happening, and slowly the neurons network will grow and the brain will achieve the function. So that's how you are able to see the recovery in the patient. Okay. So you see a patient after discharge, the movement status, and after 1 year of physiotherapy, you can see the increase in movement. Why? Due to neuroplasticity. It's the brain's ability. But with the help of physiotherapy, we are able to achieve that because we are giving them calculated, goal-directed, task-specific exercises that is working, and we are able to achieve with the help of neuroplasticity. So repetitions, more and more firing up of the neurons. All right. So more and more exercise will consistently show increased level of BDNF. And this is not me talking. It is the research talking. Okay, this is not the theory. It's a proven thing. Even the research has proved. Even the functional MRIs have seen the changes in the brain structure. All right. I'll come in the future slides. I'll show you the investigations which has already proved that there are changes seen pre and post in the stroke patients after the exercise protocols. And of course, in the movement, you are able to see the changes. So you see the observation in the improvement in the movement quality. That itself is a proof that the brain has changed itself and the motor cortex has fired up properly.